morning, everybody, and thank you all for coming. I am State Senator Henry Martin, and what we're here about today is the Healthcare Workplace Abuse and Violence Bill that we've introduced beginning in January. Like many of you, I've long held the belief that when I went to a hospital, that they're safe places and in order to receive healthcare treatment. Places where you go for emergency care, a scheduled surgery, labor or delivery services, diagnostic testing, as well as patient education. It's an environment one goes to get treated and to be healed. And this past summer, I learned that hospitals were not so safe a place. I learned, that one of the most difficult problems facing healthcare professionals today is they are experiencing verbal abuse and physical violence from patients, their family members, and patient friends. It's happening in my hospital in Bristol, as well as hospitals throughout the state of Connecticut, as well as throughout the country. And thanks to Nancy LaMonica, Vice President and Chief Nursing Officer of Bristol Hospital, and the entire staff at Bristol Hospital and the Connecticut Hospital Association, HB 6741, an act allowing improving the safety of healthcare providers and patients, was introduced, and it passed out of the Public Health Committee and Appropriations Committee unanimously. Next week marks National Nurses Week. To show our gratitude for their dedication, along with my colleagues here today, standing with me, and the Public Health and Appropriations Committee members, we're calling on the House leadership to quickly pass the legislation which both establishes a funding stream for changes to our hospital infrastructure and permits hospitals to make policies regarding when a patient receiving non-emergency care to be removed from the site if their conduct threatens the safety of others. Policies such as these are critical to promote the safety and health care of our providers as well as patients alike. And at this time, I'd like to introduce my colleague in the Senate, Senator Saud Anwar, who is the chair of the co-chair of the Public Health Committee. Senator?
Thank you. Good afternoon, everyone. Thank you, Senator Martin, for your leadership. I am honored to stand here. One of the most important jobs in our state is that of a nurse. And right now, the number of nurses, based on the population of the state of Connecticut, we have the most unfilled positions for nurses in the state and in the country. This is something that has multiple reasons. One of the reasons is the difficulty associated with this job. Unfortunately, what we have seen is that the job itself, which has been very difficult, it is becoming more complex because of the physical violence and the attacks on the nurses, whether it's in the form of verbal attacks, but now it's become physical, and it has become a dangerous job. And we have a responsibility as a state to protect our nurses. We have a responsibility to make sure that we work with the Connecticut Hospital Association. We have the responsibility to work with the Department of Public Health and all different state agencies to make sure that the jobs of the nurses are protected, but their presence, their safety is going to be of paramount value. So Senator Martin, you've been a leader in this effort, and I want to thank you for that. And it is important that we continue this work forward because this is so much needed. And I want to thank the nurses who are here. And I wanted to also introduce the ranking member of the Public Health Committee, Senator Summers. She has been one of the longest serving legislators in the Public Health Committee in the leadership role. And she has invaluable information, and I'm honored to call her a friend and a colleague, and we work very well together. And thank you for your leadership. Thank you.
Good morning, everyone. I know it's a little hard to hear. My name is Senator Summers, and I am the ranking member of the Public Health Committee. I want to thank Senator Martin for bringing this to the forefront. This is something that has been escalating for years now, and we have to make sure that the people that are caring for us in the hospitals at sometimes our darkest times are protected from individuals that are potentially causing harm and violence within the walls of our hospitals. I would like to say that many hospitals do a fantastic job. I don't want people to think that if they go to the hospital, they are unsafe. This is about the people working in the hospital that are caring for us every day. They are under tremendous stress. We have a shortage of nurses. Sometimes nurses are working many hours. And to deal with patients that become agitated and sometimes violent is not a fair position for us to put nurses and doctors in. This bill helps to combat that. It provides money available for hospitals to apply for grants to help improve the security in their facility. We want to support all of our healthcare workers, but next week is National Nurses Week. And what a better time to show our support for nurses than having our House unanimously take this bill up and vote in support. This is a wonderful bill. It is important. It's safety in a time where we need to support our healthcare workers working in hospital systems as much as we possibly can. Now is my honor to introduce the chair, the House chair from Public Health, Representative Christine McCarthy-Vahey.
Hi everyone, I'm State Rep Kristen McCarthy-Vahey. It's my honor and privilege to be here today. I want to thank you especially, Senator Martin, for your leadership. From the beginning of session, I have said that we need to be helping the helpers. Our nurses have been on the front lines and over the past few years have faced trauma on many levels. They have been there to help us walk through what has been an historic time in our lives and in the history of the world in many ways. This bill will help us to help them. This will allow us to provide additional safety measures, additional security measures for those who are on the front lines for us in our healthcare settings every day. I will say that this bill is one tool of many that all of us, as we continue to move out of the pandemic, need to be working together to assure that our healthcare providers have all the supports that they need. And that we also, as we are patients, we need to make sure that we exercise our patience. It's difficult when nurses are facing folks who are at the most vulnerable points in their lives when they're in the hospital. And we need to make sure that they are not vulnerable and they are protected. And I look forward to working together with my Senate colleagues to see that we can do just that. Thank you.
Okay, at this time, it is my honor to introduce Alison Vail and Ellen Crowe from the Connecticut Hospital Association. Alison Vail is the Connecticut Hospital Association Vice President of Quality and Patient Safety, and Ellen Crowe is the Connecticut Hospital Association's Director of Clinical Excellence and Care Redesign. Welcome.
Good afternoon, everyone. I'm Vice President of Quality and Safety at Connecticut Hospital Association, but I'm also a nurse. So I want to thank our lawmakers and legislators for, supporting this bill. Whoop. Can you hear me? Okay. So I would like to thank our legislators and lawmakers of the Public Health Committee and Appropriations Committee for bringing this bill forward, listening to and hearing our healthcare workers, and supporting this bill. As you know, Connecticut has a dedicated and exemplary workforce. They are really committed to the work, but they're exhausted. They've come through the pandemic, but they're also dealing with workforce shortages, which has really put such a burden on them. At the same time, of course, the violence and what they're dealing with every day has put them at huge risk. As you probably know, that healthcare workers accounted for 73% of all non-fatal workforce illness and injury related to violence in the workplace of all industries. It's a huge percentage. And that's data from 2018, the Bureau of Labor Statistics. When we look at the data, in the last 10 years, we've been at a consistent increase in the rates of violence against our healthcare workers. In fact, from 2020 to 2021, there was an increase of 28% in the amount of reported violence against our healthcare workforce. And as my colleagues in nursing told me and reminded me that oftentimes we don't report. So that's just the reported violent events against our workforce. So the continuous efforts of Connecticut hospitals and health systems in partnership with CHA to prevent violence and make hospitals safer, in the broader scope of really trying to retain and grow our workforce, we would really benefit from state support as proposed in this House Bill 6741. So with that, I want to introduce you to Ellen Crowe, my colleague at CHA, who will give you a little more detail on the specifics of the work that is being done across the state to support our workforce in this area. Thank you.
So, good afternoon. Alison Vail and myself, we are both nurses that work at the Connecticut Hospital Association. And we have seen significant changes in healthcare throughout the years, and I share the concern and the statistics that bear that out about the escalation of violence affecting our healthcare workers. CHA is and has been committed to helping hospitals identify and implement best practices aimed at reducing healthcare violence for the Connecticut workforce within our hospital systems. This is important work because workplace violence has severe consequences for the entire healthcare system. Not only does violence cause physical and psychological injury for healthcare workers, workplace violence and intimidation make it more difficult for hospital staff to do the job that their patients and communities are relying on. Physical violence will make the news, but the old saying, "Sticks and stones may break my bones, but names will never hurt me," is simply not true. The verbal assaults, name-calling, intimidation, threats, they decrease morale, motivation, and staff resilience. That's exactly why CHA and all of the Connecticut hospitals and health systems have been focused so intently on providing a safe setting, addressing both the physical and emotional violence within hospitals for everyone who enters them. Connecticut hospitals have established workplace safety committees, including management and staff, both partnered together to conduct risk assessments, develop plans, and meet regularly to implement and modify those plans as required and as situations continually evolve. They are recognizing and addressing environmental safety risks for patients as well as staff and making changes to reduce the occurrence of incidences. Hospitals are identifying patients at risk for the propensity of violence, individuals who are at risk of intentionally harming themselves or others, and taking steps to mitigate that risk. Ongoing education and training to staff, and volunteers on crisis prevention and de-escalation techniques so that we can identify behaviors that are concerning early. This protects and ensures the personal safety of everyone at our hospitals. Should one of those unfortunate events happen, hospitals have set up supportive peer networks within their workplaces that can help individuals who find themselves traumatized by these situations to speak to specifically trained individuals who assist them in their recovery. HB 6741 includes several measures that would be another positive step toward making hospitals safer for all. This has to be the main objective. As we look forward to celebrate and honor Nurses Week next week, supporting policies like this will be one of the most important ways that we can truly support them and show them how valuable we feel that they are. It will bolster hospital efforts to support, retain, and grow the healthcare workforce at this very critical time in history. Our hospital workforce simply deserves no less. Thank you.
Thank you. And at this time, I'd like to introduce the person that brought this to my attention when I visited Bristol Hospital over the summer. She heard I was on the floor, and she asked for 10 minutes of my time, and it turned into about 20 minutes of my time. That led to a meeting with the entire emergency staff department of Bristol Hospital. So at this time, I'd like to introduce Nancy LaMonica, who is the Chief Nursing Officer of Bristol Hospital. Nancy?
Good afternoon, and thank you, Senator Martin and Senator Anwar and the legislative teams here at the Capitol. It's my honor today, I hope you can hear me because the message that I have for you today is extremely important. It's my honor to be here to support healthcare and nurses in making our environment safer. I have been a nurse for over 35 years, and it is my responsibility now to care for my nursing practice within the walls of my hospital. My nurses are excellent, but they cannot be abused on a daily basis. We have been in the business of tracking how much they are abused, but that is not okay. We need to do the same thing that we have done for patients. We had a mission to decrease patient safety to zero, and I am on a mission to decrease healthcare violence to zero. My nurses deserve nothing less, and every healthcare worker that you encounter deserves nothing less. I want you to hear from a few of my nurses on the team to have them tell you a few of their stories.
Hi, my name is Tiara Brown. I've been a nurse for about 14 years. I'm currently working as a nurse at Bristol Hospital. Thank you for the opportunity to be here. I just want to report on a few occurrences that have happened to me personally. So I've been assaulted at least 3 times in my career. I've been spit on, punched in the face, and most recently I've been kicked in the chest. I've also had a knife pulled on me when I was working in healthcare and home care. I've also been threatened to be raped and killed by patients. None of these assaults should be tolerated. On each occasion, I did file a police report, but after each assault, I was informed by police that the patients would likely not suffer any consequences. All of the patients who have assaulted me and everyone else should be held accountable. The recent news reports have made my loved ones fearful for me while I'm at work. I am more hypervigilant while working and out in the community for fear of being assaulted. Unfortunately, my experiences do pale in comparison to those of my fellow coworkers and other people I know in healthcare. I have one nurse that I know who has worked in healthcare for a very long time. She was so brutally assaulted by patients that she ended up needing surgery and was out of work for an extended period of time. Another healthcare worker that I've worked with has been punched in the face and in the head multiple times by various patients, leading to multiple concussions. A psychiatrist that I know very well she was not even treating this patient, but she was assaulted by that patient. She had to miss most of work for 2022 and is contemplating never returning back to work. Violence against healthcare workers should not be the norm. It should not be tolerated. The general public must be made aware of the potential consequences of their behavior, and it needs to be followed through with by the judicial system. Without a change, there will be fewer and fewer healthcare workers willing to provide care for people who need it. Thank you for the opportunity to be here.
Good afternoon. My name is Deb Martin, and I've been a nurse for over 30 years. I just want to shout out to Senator Martin for listening to the voice of nurses and having the conversation with him. He spent time and listened to the nurses at Bristol Health and wanted to do something different. As Nancy mentioned, we just can't keep collecting data anymore. We need to take action. I have friends and colleagues who have been hurt, spit on, and kicked. It would be nothing more than the biggest thank you to nurses and healthcare providers next week as we enter Nurses Week and thank them for passing this act that will help decrease healthcare violence to zero. Thank you so much.
I just want to share with you that over my years of experience in healthcare, when I first started as a nurse, violence was at a minimum. We might encounter it maybe once a month, once a year. Somebody might yell at us, or somebody might grab our arm or kick at us. But over the past decade, we can say that healthcare violence happens on perhaps every day, every hour, every minute, depending on which bed or patient room that you enter. And this is not okay. I am so honored to be standing here today to hopefully have you pass this bill that's in front of me and make sure that our nurses know that their voices were heard. You know, we are here to care for you and our customers in our community. We want to reduce suffering. That's our oath we take as a nurse. And I want you to know that we cared for you during the pandemic. When many people were inside their houses and they were isolated, my nurses were on the battlegrounds and we were out there caring for you. And it's time for you to care for them. You cared about patient safety, and it's time for you to take a look and care about workplace environment safety so we can fill our nursing positions, bring well-being back to our nursing environment, and care for all of you that want to come to our healthcare facilities. Thank you so much for this opportunity today, and I appreciate everything that you're doing for us.
Thank you. Thank you to my colleagues, as well as all the nurses that came here today. At this time, we'll entertain any questions that you may have.